if you take it healthcare, for instance, if there's a front desk person and that
Mhm.
person really should be focused on the patient coming in, but instead they're manually scanning paperwork and typing in different things, stuff that could be machine learning or AI driven. We could know that this patient came in with this particular initial complaint. These are the questions to ask, and it can pop up with those questions instead of relying on that human to think through that, where they can handle more patients at the same time and provide a better customer service experience.
Hi, everyone. Welcome to this episode of the Leadership Exchange podcast. My name is Tracy. You can follow me on Twitter at Lady Leet or on LinkedIn. I hang out a lot there these days at Tracy S. Lee. And I am so excited today to welcome Monique Weeks to the podcast. Welcome, Monique.
Good afternoon. How are you, Tracy?
Good. I'm doing so good. It is almost summer, although I guess it's spring. I don't, when does it become summer? Is it June or
Summer's
July?
June, spring is like in 2 weeks, and clearly allergy season's hitting for some people, so it's you can tell.
Oh my goodness. And we're both in Atlanta, so we are covered in pollen
Yes, we are.
soon, I
Yeah.
suppose.
Get your Claritin and your Allegra ready because it's coming.
So, Monique, I'm so excited to chat with you. We recently met. For those of us who don't know Monique, she has been in healthcare all her career. So you've been just an amazing leader there, and then also an amazing leader for WIT. You're on the board of a local organization called WIT.
Yes, Women in Technology Atlanta has been in my life since 2007. So about 18 years I've been working with WIT in different capacities, but this is my third year on the board of directors. It's been fantastic. But healthcare IT has been my what I've done. I've been at McKesson Corporation for over 10 years. Most recently at PT Solutions Physical Therapy. I've been at Aviana Healthcare. So all over in healthcare IT, bringing that patient and provider experience to the table so that we can make sure technology is at the forefront.
I love that. Well, that's amazing. And that is why you were also recently asked to join a panel for the Salesforce AI Summit. Pretty cool.
Yes, yes.
Uh, yes. Tell us a little bit about that. So they were talking about AI in healthcare, I'm assuming.
So they weren't just talking about healthcare. So basically, Salesforce had an initiative along with Women in Technology in order to celebrate International Women's History Month.
Hmm.
And at the same time, Salesforce just recently released Agent Force, so their AI tool. So they had a couple of leaders like myself, some leaders from Salesforce, some that are in education, talk about how you reskill and upskill to prepare for AI. So I was on a panel there, but it was a full day of activities at the Salesforce headquarters in Atlanta where we talked about, what are the different kind of facets of AI? What are those fears that are out there about AI? And how do you prepare yourself, whether you're new in the industry or you're a veteran in the industry, but trying to think about how to take your skills to the next level in artificial intelligence. So that was my portion of it. I specifically did focus on healthcare, but it wasn't just that spin. And the thing is, AI can be used in pretty much all industries. But right now, if you're a person that's like fearful of AI, wondering if it's going to take your job, all those other things, there are things you can do to prepare yourself. Like Salesforce is offering an AI certification, an associate and a specialist certification, and it's free through all 2025. So that is what we were doing there. We were prepping for the exam. A couple of people took the exam. So it was a really, really great day. Yeah.
That is pretty cool. This conversation really inspires me. I've been wanting to do this, and I feel like I've had this conversation a few times right now. This whole idea of people being scared of AI taking their jobs, what does that actually mean? But I like to equate, kind of like make comparisons to the 5 stages of, is it called the 5 stages of grief?
Oh,
Right.
yes.
Where
Like
there's,
denial.
right, like denial, this, that, whatever, and then finally acceptance. So I think that there's something to be said there as well, right? Because being able to change an organization and lead an organization to, hey, you know what? AI is here. It's not here to take your job. Okay, let's not be scared. Okay, you're not scared anymore. Now let's try to get you guys to use it. Okay, you're a little apprehensive still. Like, what are those actually specific stages that teams are going through? And then also, where are you within your organization in terms of that adoption phase?
Right. I think the main thing is to think about AI as an empowerment tool, not a replacement. Right. It's
Hmm.
going to empower us to do more in some cases with less, but that's not meaning less people or less jobs. If you take healthcare, for instance, if there's a front desk person and that
Mhm.
person really should be focused on the patient coming in, but instead they're manually scanning paperwork and typing in different things, stuff that could be machine learning or AI driven. We could know that this patient came in with this particular initial complaint. These are the questions to ask, and it can pop up with those questions instead of relying on that human to think through that, where they can handle more patients at the same time and provide a better customer service experience. So it really is thinking about how we empower the tools that we have with AI and not replace people.
Yes, I definitely love that. I always talk about there's this phase actually after the acceptance or adoption phase of AI where all of a sudden your team's like, "Oh, this is so great. I can use it," and they're using it for their jobs. But
Hmm.
then I don't know what happens, but I think that there's this phase where like like a lot of people's brains kind of turn off and they're like, "Oh, well, AI is doing a job for me, so it's good enough." But then everything feels like AI generated, or, even if you're talking from a development standpoint, right? Like, it's like, yeah, this PR was good enough, right? The code was good enough. But, then it's training your team to actually remember that there's a human in the mix for a reason. There's a human in the mix because you do need to kind of be that senior, in many cases in my world, it's the senior developer, right?
Yeah. You got
Or
to
like,
review the code. You got to make sure it's right.
right.
It's just AI is just guiding you there, but you got to make that last sign off as a human
Yeah.
on whatever it might be.
Yeah. Or even when you talk about from a patient experience perspective, right? Like
Hmm.
AI is going to get something wrong. You better be there to like still have the conversation with AI or correct what AI is trying to,
Yeah.
assume about a patient. So, I think that goes to say that AI is definitely not taking our jobs, and you really need to have that balance with human touch and technology at the same time.
You absolutely do. And even when they think about AI models and things that are doing that, AI can have biases, right? Because if they're
Mhm.
going by, it's pretty much almost like the 80-20 rule, where this has happened most of the time with that type of patient, but this patient's an outlier. AI won't necessarily pick up on that, right? It may
Yeah.
just look at all of it's been all this gender or all this pre-existing condition, and it won't know that nuance that this is a different patient, this is something different. That's where that human element comes in to review it and see if this makes sense for that patient or for whatever you're using the AI for. So
Yes.
yeah,
Yes.
that adoption, that denial portion, I think people are still a bit in if you think about those phases of grief.
Yes, it is. It is very exciting to see some people come out of the early adopter phase, though. I've definitely started seeing that in the tech world a lot.
Hmm.
But when you see opportunities with AI in healthcare, is there anything that particularly excites you?
I think the thought of documentation through AI, so a therapist or a physician, and that documentation being assisted by AI. And I think so because I've been a patient, right? I've seen a patient, I've dealt with family members, and I think at times with all of the documentation and paperwork and all that of healthcare, they're losing that bedside manner. They're losing the
Mm,
ability to really focus on the patient. So if they can communicate with the patient and there's a tool that's picking up on the notes and picking up on the key elements of what's going on, they can really be more in tune with that patient experience. So I think that
yeah.
the ability to use documentation tools that are AI driven will
Mhm.
actually help. And it'll also ask some of those questions that you might not think of because you're, again, focused hopefully on the patient. AI may pick up different kind of trends that say, hey, wait a minute, find out if they're a smoker or whatever that might be, something that
That's so
might lead
interesting.
somewhere else. Right.
Yes. I mean, you're basically talking about taking it outside of just note taking, then. You're talking about having AI kind of be a little bit of an assistant, if you will,
Yes.
in the patient experience. Yeah. Yeah.
Hmm.
Have you ever are there any tools out there that currently do that?
Yeah. Yep. I've demoed a few of them that
Mhm.
do that. It's pretty cool. And that's really where I want to take my career next. Like I've been thinking more about how we can transform healthcare careers with that tech savvy healthcare professional and combining that with some of the tools out there that may not be at the forefront yet because there's a lot of tools that are still in development that I've heard about. There's
Yeah.
one that I've been talking to one of my former peers about that's in the emergency room. So right now, one of the things that goes on in an emergency room, if you've been in one, it's
Hmm.
always a lengthy process, or it seems like it is, and you really can't tell how long you're going to be there. You get there and you just kind of wait. Well, there's a
Hmm.
tool that might be able to look at some of the pre-existing conditions while you're here and kind of estimate how long you're going to be here and really fill in some of the questions and gaps. Again, if it's a urban area and it's a pretty busy ER, how do we get through that intake process a little quicker? So there's
Yeah.
tools around that. And like I mentioned, physician and therapist documentation, nursing documentation, there's quite a few tools there. So there's a lot out there that I've been researching and a lot more to come.
I was just thinking about my own personal experience with note takers, right? I always laugh because most of my meetings are online and I always have a little robot following me around taking notes. But the summaries, sometimes they're good, but
Hmm.
sometimes they miss the mark, right? And
Yeah.
so uh I was actually thinking about you talking about the patient note takers, and I know some of my friends in healthcare who are physicians are using like an AI note taker to kind of help assist. But I think just like my experience with meeting note takers, when they're missing the point, right? Like that very nuanced point that like a human who had to be there needed to understand maybe like the tone,
Yeah.
right, of what was happening or whatever cultural nuance there might be, right? Like this person said this, but they actually meant this.
Yeah.
Um, that I hope, and I think again, going back to this whole idea that like AI shouldn't completely replace your job, but I hope that physicians are taking that into account when they're taking notes so that the notes aren't misleading, if you will.
Right. And I think that's where it comes into reviewing those notes. We can't just go with AI. And it's just like when you have your meeting and you get
Yeah.
that, readout from Teams or whatever you use, you still kind of got to go through that. And some things might have been missed with the inflection or the tone of what was said. So I think it's still the case where we have to have that human intervention or have the
Yeah.
AI model trained to pick up on different languages or different accents and things like that in order for
Yeah.
it to really be successful.
Oh, I have another use case actually, and this is so funny that you just got my brain going on this. So, um, I don't know if like once you get to a certain age, let's say men specifically, I heard about this use case recently where there was a guy who went to a cardiologist,
Hmm.
and the cardiologist was like, "Oh, if you're thinking about getting life insurance, you should do it now if before I run all of these tests." Right.
Hmm.
And, the cardiologist said, well, I'm not going to put these in your notes. But now if you have an AI listening, all of a sudden that's going to be picked up. And then, so and then it's funny because when you do life insurance, right, they request all the doctor's notes and everything like that.
Yeah.
So then goes the question are all the AI notes now, going to be part of the insurance's ability to request or not, and what does that actually mean? I know that this happens a lot as well, right? Like when you do like when you're like doing fertility stuff, right? Like does a doctor say you had a miscarriage or not, depending. So there's all those
Hmm.
little nuances I think that happen inside the patient's room. What do you think of that? Like do you
Yeah, I think at least the tools I've looked at, they won't necessarily use that AI note taker, the results directly in the chart at first.
Mhm.
That has to be reviewed and kind of submitted. Just like if you did your handwritten notes, you would proofread it and then
Right.
you would say upload. So I'm assuming, and this is exactly how I would hope it works, where you don't automatically just send the AI notes without that review and taking out things that may not be appropriate to leave in the note because it could be a
Mm.
conversation that that isn't a part of what's in the actual final record. So it may be
Mhm.
that it's just that review process prior to submission of the note and it's in draft. So the
Mhm.
draft would be in one place, but the actual, final would be elsewhere. Now, that may not hold up legally. So if that
Mhm.
case though is
Mhm.
malpractice or something like that, they may need the draft and the final. But the
Right.
final is what would go to the insurance company or to wherever it might be based
Yeah.
on what that needs to know, that HIPAA side of it, where
Yeah.
this is what needs to be communicated outside of just outside of the medical record system.
So
So I would hope
interesting.
it's like that, where it's not just yeah, they had that conversation, and it went on. All the conversations in the room went on over to wherever, like it was released.
How
So that's
fun.
how I would see
Well, if
it.
anybody is listening who is in the healthcare space, who is actually working on the solution, we would love to know what your ideas around this are. Help us demystify. Definitely let us know in the comments below, or just hit one of us up because
Right.
we're curious.
Right. That was definitely not an answer that's definitive. It's just my thought, just based on, the draft of medical records before the physician signs it, and they have to go through and make sure that everything is correct in a paper, back in the day when they had,
Right.
before AI was there, they would just type, or the transcriptionist would hear it, type it, and it could be some stuff that they got incorrect. So it'd be
Yes.
redacted appropriately. And the final would be
Yes.
what would go to the, release to other doctors, etc.
Oh my gosh. Yeah, I mean, with AI and everything happening, it's just so fun to see the innovation that's happening. And again, all the little nuances, all the little questions of like, well, how is this case going to be handled? How is that case going to be handled? So, um, yeah, it's gonna be a fun next 5 to 10 years, I suppose.
Yeah, and I mean, we got to get ready for it.
Yes.
When I spoke at the Salesforce Summit, I mentioned this too. You, if you don't get on board with certain things that are happening innovatively, period. Like you could think about the cell phone back in the day. Everybody had a BlackBerry, and it was buttons everywhere on the phone. But now your phone looks like there's no buttons anywhere.
Mhm.
If BlackBerry didn't innovate, where was it going to be? So like thinking through how you must stay focused on innovation and really
Yeah.
understanding how you transform your skill set in order to still be relevant.
Yes, yes. And speaking of which, you recently took a sabbatical, and it's funny because when you said sabbatical, I was thinking I don't know if I would consider like full-time board member as a sabbatical,
Yeah.
but you recently took one, and you've again been such a great leader, and I think you taking a sabbatical is really a good signal to everybody who looks up to you to say, it's okay to take a breath sometimes.
Yes. Yes, it definitely is. It's interesting, when I decided not to pursue anything else right now following leaving my last company. I thought for sure that a lot of people came to me like, "You ready for this?" So I have this position for you, and I had to be like, "Not yet." Like I
Hmm.
knew that right now I needed a moment, and
Yes.
I'm really proud of myself. But I also have had heard from other leaders that are in similar positions that have
Yeah.
decided to take a break. Or some of them are saying, "Oh my goodness, I took a break in 2018, and that was the best thing I could have done." Like there's a lot of
Yeah.
people that have done this. And I think for me, spending a lot more time with my children, spending time on the passion that I feel for WIT, for women in technology, spending time with the single mothers from the single mothers program at WIT. So doing a lot more with women in technology is actually feeding my soul, like feeding me to
Yes.
the point where it gives me more insight to what I want to do next, right? I want
Yes.
to be able to do a role that allows for me to give back like this. And I'm noticing that there are companies that really focus on that. Like I've been at Salesforce, I've been at Cisco. There's a lot of companies that really do have that mindset of bringing your whole self to work and making sure that have that support that you need. You're building up new leaders. Like, and when I was at McKesson, that was really big. Like, leadership programs, making sure leaders have the ability to grow within the organization. That's the type of stuff I'm looking for. Just really being intentional. I am starting my search now, but not aggressively because I still felt like I wanted to really be thoughtful about what I want to do next.
Yes.
Yeah.
Well, that's definitely such a blessing. I always ask every time we hire somebody at this dot, I'm like, okay, you need to give her 2 weeks. Okay, so when do you want to start? And whenever they don't take a little bit of a break, I'm like, are you sure you want to do
Right.
this? Friday you leave a job and then Monday you start another job.
Yeah.
Um, and I always like my friends who take a few weeks off before their next position. I mean, it's good. Sometimes business won't wait for you, and that's kind of annoying too, but it's always such a blessing to be able to have that space.
It definitely is. It definitely is. It just,
Yeah.
yeah, you spring forward a lot quicker that way. Like once you take the break, and even if it's the person that ended that Friday and they took a week off before they started a new job the following Monday,
Yeah.
I think that just gives you a chance to have a clear bookend. Okay, I'm putting this chapter behind me. I'm thinking through what I want to do next, and I'm going in with intention to the next endeavor.
Yes.
So
Yes, 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 yes.
to your
So,
point, I'm sorry, you mentioned something about being a full-time board member with WIC.
mhm,
Doesn't sound like a
mhm.
break, and I get it. Like I do get a lot of people saying to me, "Are you sure you're taking a moment? What are you doing for yourself?"
Right.
And I'm
Right.
definitely balancing that out a bit. But I do think that again, when people take these breaks, they really got to think through what do you want to accomplish during this time. And some of it may be, I truly want to go to Costa Rica or whatever that might be. I do want to do
Right.
that. It just
Yeah.
really, you really kind of still have to be somewhat intentional and then somewhat like, I just want to chill. Like I need to take some time off and really just think through, take some time with your children, whatever that might be for you.
Yes. Yes. It's like the difference between different people go on vacation differently, right? Some people plan out, hey, here's the 8 activities we need to have, and some people just kind of wing it and show up. But I'm the type of person where it's like I'll plan it and then it's fine if it doesn't happen, but at least I have a little bit of a plan.
Right. I'm
So,
more of that hybrid too. Like I want one or two things definitive on the vacation and then the rest of it I'll leave to chance.
yes, yes, I love that. So again, kind of being in executive leadership, right? And the fact that you are a great example of how you can be successful and also focus on wellness. What recommendations do you have for people to kind of help people maintain, your own mental, emotional, and physical well-being when you're on meetings 24/7 and you never stop?
Well, there's quite a few things that I think have been useful for me. One is just having a good, I call it personal board of directors. So having a
Hmm.
good group of solid people surrounding you, whether that's in your home and your husband and the balance of juggling, your family and who's going to take who to volleyball practice. So it's that shout out to my husband, Chris, who makes things possible for us to juggle these things. But then it's also, there's your friends that may be in the same line of work or similar line of work that you can bounce things off and that stress is coming, but it's like, you know what, meet me for happy hour after work. So it's really having the balance of, and I jokingly say happy hour, but it could be anything. Meet me at the WIC breakfast, meet me at this. But it's really having a good balance of people that hold you accountable, that see, wait a minute, Mo, you might need a break, or that self awareness of yourself to say, wait a minute, I need to pour into somebody else now, or I need to be the one poured into. So I think balancing as an executive leader, it still is important to have mentors. Like I think people think I need a mentor when I'm in the early entry level stage of my career. No, when you get to the point that I'm at now, I have other C-suite executives and other people that I know in my circle over the years that I've met that are able to tell me, "Hey, Monique, let's kind of go have breakfast. Let's talk through some things. Let's bounce ideas off each other." And sometimes it's let's just take a walk, right? So sometimes it's really thinking about who's my board of directors, who's my circle of influence that help me through things, but I also help them. So it's a lot of symbiotic relationships, and I've been blessed to build quite a few of them that are personal and professional and feed me in different ways. And then, they're supporting me during this time off. They're like, hey, I walk every morning. I haven't walked the last few weeks. It's been cold with a group of women that really, speak life to me and I speak life back to them. So I think that's important for leaders to remember we're people and
Yes.
that human side of our, day-to-day activity needs to be something that's balanced.
So what is this disconnect, right? So I depending on the generation you're in, right? So, a lot of people talk about this new generation that's coming in. And I can't remember if it's generation like which generation is it after
I never know the
millennials,
whole
but it's
Z or X or I don't
yeah,
know.
whatever generation we're at, right? This whole idea that they some people say, oh, they don't want to be leaders, or, they care more about what they're doing on a day to day. And, they just kind of want to show up for work and that's it. And, a lot of times we think about that as, you can also say, hey, you know what, they have better work life balance. But
Hmm.
I think some people say, oh, well, they don't want to lead. Like, how do we get them to be invested in the organization? Like,
Mm.
this new generation is not invested in the organization enough. But then I think on the other side, you look at folks who maybe, are I don't know, 10 years away from retirement, let's say, or something like that, right?
Mm-hmm.
And, they're wanting to, and I mean, I think every generation kind of has folks like that.
Yeah,
Um, but that there's this kind of like evolution of workplace culture that's happening right now, right?
it
Where,
is.
okay, you know what? Different leadership styles are more accepted or desired in the workplace, or the expectations for wellness are a little bit different, right?
Yeah. Mm-hmm.
Um, what what do leaders need to kind of like understand in this time and age, and what do they need to kind of be focused on to kind of help with the evolving work culture?
That's a great question. And it is easy to be in an organization where you have the whole gamut in your team. So you
Mm-hmm.
have the younger workers, the ones that are more kind of like the social media culture, and then you have
Mm-hmm.
workers that may be towards the latter stage in their career. So I think leaders do need to be fluid enough to understand all
Mm-hmm.
of those different facets of timing, and you have to kind of meet people where they are, because
Mm-hmm.
that newer generation, they prefer only to communicate via text. They may not want the face to face
Mm-hmm.
versus previous, people that have been in stages of their life where they're like, I didn't really text everything. I need that verbal communication. I think you have to meet people where they are. You have to be
Mm-hmm.
willing to say, when I meet with Mary, I have a one-on-one in person
Mm-hmm.
versus it's okay for me and Bill to meet by phone or to,
Mm-hmm.
text, to have a, virtual meeting. But I
Mm-hmm.
think it really is a question of understanding your people and even your self-awareness. Like, how do I learn? Because a lot of people don't realize what their needs are. It's almost like, we just used the 5 stages of grief, right,
Mm-hmm.
earlier.
Mm-hmm.
Another popular thing that's used for relationships is love languages, right?
Yes,
So I
yes.
think it's the same in the corporate environment. It's not love, but what is the language that they need to receive? How do they need to
I
receive
love
feedback?
that.
How do they need to,
Yes.
how do they need to receive feedback? How do they need to, is it going to be a big deal for them to get a financial increase or merit increase, or more PTO might mean more to someone else? Is that flexibility there? So I think
Yeah.
it's back to the love languages. If you want to make it simple, you just have to understand your team and the organization that you're with and see if they're willing to kind of flex some things a little bit more for certain roles, or just really understanding the people you work with and for.
Yeah. I mean, you would think, right, that if you're kind of like at the later stages of your life and you're prioritizing more purpose in life, and what do I do? I hear a lot of folks who maybe again are like 5 to 10 years out from retirement, and they're like, well, what's the lasting impression I want to make,
Mm-hmm.
in the last thing I'm going to do in my career. um and they're looking for purpose, which is
Yeah.
again not so dissimilar to the
Mm-hmm.
newest generation that's just getting out of college, that's like getting into the workforce. So what is this middle like middle group doing, um but I think the middle group right now is kind of like in the millennial generation.
Yeah.
And then it's kind of funny though too, because I feel like a few years back, right, it was kind of like the baby boomer generation that was kind of like
Mm-hmm.
wondering what the hell was going on. So maybe we give too much um credit to like, oh, this new thing is happening, to where maybe
Yeah.
it's just stage of life, right?
It is. It is. It's definitely stage of life. It's definitely
Yeah.
a question of self reflection. Like, I can
Yeah.
think about my parents' generation where they stayed on the same job 30 plus years and they retired, period, hands
Mhm.
down. So, looking at me, and I'm like, I've been at, 10 years, 3 years, 4 years. Like, that's kind of like how it's been. That 10-year job, I anticipated being there forever when I was with McKesson. But
Mhm.
things change and people do not stay more than like 3 to 5 years. That seems like the norm, right?
Mhm.
So of course your parents are looking at you sideways when you're in this sandwich generation where I'm raising my parents and raising my kids. Like, I'm trying to work through all of that, but they're like,
Yeah.
"Wait a minute, you're not working?" Or, "Wait, you were only at your job 5 years?" I'm like, "Yeah, I mean, I'm not going to be there 30
5
years.
years
It
is
just
for and sometimes 5 years is forever. 5 years seems like forever to me.
now it does, but back
Yes.
then they didn't leave. Like, they just
Oh,
didn't
yes.
leave their jobs, and now a, a, a millennial might look at me like, "Wow, you were there 5 years? Like, that's a long time." So like
Yeah.
everybody has a perspective that
Yeah.
differs, and I think it's just a meet people where they are
Yep.
and be accepting. that things are changing drastically, right? And you just have to keep reinventing yourself. You have to take a break sometime and kind of look at yourself and say, what do I want to do next? Do I want to be somewhere 5 years? Do I want to be a consultant? Those are the type of things I'm thinking about. And
Yes.
I think, it's just such a different mindset. It's just such a
Yeah.
different mindset. And you just got to be willing to be innovative even with your next steps in your career.
I love that. I mean, I think the biggest takeaway that I've been really hearing, and I feel like this podcast really solidifies it, is this idea that, you shouldn't be like, I guess, like bucketing everybody into like, oh, well, this generation cares about this. It's really stage of life. Like, what stage of life are you at?
Hmm.
And how are you prioritizing it? Right. So I love
Yeah.
that. And I know that you are about to start your own podcast.
Yes.
Tell
Super
us more
excited.
about that.
Yeah, and it ties into some of the things that we're talking about. So it's
Hmm.
called Unmasked Conversations, and it's
Hmm.
essentially sitting down with leaders like myself, to people like you, and just thinking through redefining success for these different stages of your life and
Yes.
really looking at life lessons and leadership. So it could be a conversation. I remember I spoke to someone recently, and I want to have them on my podcast, but it's a young lady that's now entering into her phase of her life where she's having her first child. And the person was talking to me about, just kind of conversation about what does that look like for me next. Like, she's a high powered driver in her current career, but she's like, I
Hmm.
know I gotta kind of take a step back when I get ready to have my child. And I told her, and this is how I felt at that phase of my life, sometimes your promotions are personal and sometimes they're professional. What
Hmm.
I mean by that is she's being promoted to mom. So right
Hmm.
now, if the new
I
director
love
role comes
that.
up, she might not take that promotion, and that's okay. So it's the life lessons and leadership, and just trying to think through. I may not be the leader or the director. I still may be influential, so it's influence without authority, and that's okay now because right now I'm transitioning into how do I pump at work? Like, how do I do these things when I go back to work? That's a big
Right.
deal, and people underestimate the personal changes that are still yet promotions.
Hmm.
And you have to take that in consideration, talk to people that have been through it. And I think when I look at the term unmasked conversations, the point behind that is people at all the different levels, we wear a mask.
Hmm.
Yep, and I've taken my mask off to be able to share about my sabbatical, to share with this young lady about, hey, at a point in my life, I chose not to take the promotion. I said no because I knew I was being promoted to mom and wife and all those things at that point. So it's really taking the mask off and talking about what really matters to us, so people know it is not just about having a full day's worth of meetings and not balancing your life. It's not about anxiety and depression, all the things that can come up day to day, and you're not addressing it because you're like, I gotta climb this ladder. Like, you have to figure out the balance in life in order to live it. And you have to be honest with at least some people about the struggles to get to the point that you got to, not just the wins. So,
Yes. Yes, I love that. Well, I can't wait till that comes out. We're ending the we're nearing the end, not ending the near. We're nearing the end of the podcast.
mhm.
So, how do people find out more about you and more about the podcast when it's going to be launched?
So I can be found on LinkedIn, Monique Weeks, and I'll have all the information about the podcast on my LinkedIn page. And eventually, I'm starting my Instagram page directly related to the podcast, but I'll share that information at a later date. But definitely follow me on LinkedIn. If you are a woman in technology or even an ally, so a male, feel free to join Women in Technology Atlanta. It is at no cost to join, but there are great events throughout the year. I think next week we have March 16th, we have a breakfast at Maggiano's in Buckhead. So go to mywit.org and you can check that out. So looking forward to spending more time with you, Tracy, in the future. This was great, and I enjoyed you when I first met you a couple weeks back. So this is fantastic. Thanks for
I
having me.
know. And I'm definitely looking now at mywit.org to check out maybe some of the breakfast things that happen. Yeah,
Yeah.
I see the Wit single mothers, Wit Tech Uncorked, Wit
Yes.
Girls, Wit Campus. There's so many different parts. I mean, I remember first looking at Wit actually and thinking like, wow, there's a lot of stuff. But I
Yes.
think the first step is just getting involved. The first step is just going to one of the events or
Mhm.
figuring out how you can be like a mentor or a sponsor, even if you're
Yes.
not a woman. There's
And
just so many opportunities.
and it was March 19th. Sorry, Wednesday, March 19th is the next event. You have to
Okay.
sign up by March 13th. That's when registration closes. But then there's
Nice.
also May 1st. We have WIT Connect, so we're looking for companies that are willing to be sponsors. That one's at Top Golf in Atlanta. So a lot of things coming up, a lot of opportunities for companies to engage their women and their organization within women in technology, and then just for every phase from the classroom to the boardroom, right? So we
I
have
love
some
it.
individuals that are in school, and we have some that are young professionals, and we go all the way up to C-suite.
Love that. Love that. Well, thank you so much again for joining us. And for us listeners, definitely again, check out Monique and her new podcast and check out WIT. And we'll see you all next time.